Have you heard of antenatal hand expression or colostrum harvesting? If you're nearing the end of your pregnancy, you may have some questions about how to collect and store your colostrum before you give birth, when to start doing it, and the benefits of collecting your colostrum even if you've had an unremarkable pregnancy. So today, let's go over everything you need to know to get started harvesting your colostrum. Hey, I'm Courtney, a pediatric feeding therapist, international board certified lactation consultant, and mom. I strive to provide the most up-to-date, evidence-based information to help you meet your feeding goals. If you haven't already, please subscribe to my channel and click the little bell to get notified whenever I post a new video. If you've decided to breastfeed your baby, you probably have heard the term colostrum. Colostrum, which is lovingly referred to as liquid gold, is your first milk which your body has started to produce as early as 16 weeks of pregnancy. Colostrum is different from the mature milk you will see throughout your breastfeeding journey because it's packed with white blood cells, immune boosting properties, and antibodies to protect your newborn from disease and infection in those first few days of life outside of the womb. Colostrum is a clear or yellow color and thicker than your mature milk, but it's important to note here that all breast milk is variable, and I want to reassure you there is nothing wrong with your milk if it doesn't appear as dark or as thick as some of the images you may have seen. So what is colostrum harvesting? It's hand expressing and storing that first milk during those final weeks of pregnancy. And what's the benefit of harvesting your colostrum? First and foremost, it gives you an opportunity to become familiar with your breasts and how your milk is produced and removed. It can also give you a boost of confidence when you begin breastfeeding after your baby is born because you have already seen what your body is able to do. Additionally, if you're proficient at hand expression, you can avoid many early breastfeeding challenges. With that being said, some people are not able to express colostrum while they're pregnant, and that is also completely normal and does not correlate with your milk supply after your baby is born. Let's quickly run through some common scenarios where having colostrum on hand ahead of time would be beneficial. Harvesting colostrum is beneficial if you are taking beta blockers to control high blood pressure, have developed preeclampsia during pregnancy, are diabetic or have developed diabetes during pregnancy, have polycystic ovary syndrome, have breast hypoplasia where your breast doesn't develop or have had breast surgery, have a raised BMI, or plan to have a cesarean section. Having colostrum on hand is especially beneficial if baby is large or small for their gestational age, if they are a multiple, if they're born with a medical condition such as cleft lip and palate, Down syndrome, or a cardiac defect, or honestly any other unforeseen reason why you and your baby would be separated at birth. So when should you start collecting your colostrum? Many experts recommend waiting to begin harvesting colostrum until you're at least 37 weeks pregnant, and you should get your doctor's approval first. Nipple stimulation releases oxytocin, which is the same hormone that produces contractions in labor. However, colostrum harvesting is generally considered safe and is not believed to induce labor on its own. Similar to how you're able to breastfeed or have sex during pregnancy, that also releases oxytocin and is generally considered safe. Again, speak with your healthcare provider before you begin because there are specific circumstances when harvesting colostrum would not be advised. For instance, if you have cervical sutures in place or have had premature labor in the past. So what do you need to get started? You will need some sterile syringes with caps on them. If you're able, I would recommend getting a combination of 1 milliliter and 5 milliliter syringes, but definitely 1 milliliter syringes to start would suffice. When you first get started, you may want to practice either in a warm shower or a warm bath to become more familiar with the process. This can be very relaxing for you, and it can actually help release your milk. Some people have also found it beneficial to hand express immediately after a bath or shower. Either way, before you begin collecting, you're going to want to make sure that your hands are clean. So wash your hands, and it may even be helpful to trim your nails too. Then what you're going to want to do is you're going to want to gently massage around your breast. You can do this using gentle circular motions, or you can stroke downward, or a combination of the two. Honestly, do whatever feels right and comfortable for you. Then you're going to want to make a C shape with your hand, almost like you're holding a glass of water. You're going to want to place your hand on your breast about an inch outside of your areola, and you want your thumb and your pointer finger aligned and your nipple centered in the middle. And what you're going to do is you're going to press back in towards your chest wall, compress and relax. Press in, compress, and relax. And you're going to want to move your hands around your breast to get all of your milk glands flowing. So this action of press, compress, and relax is going to move your colostrum down your breast, and because colostrum is really thick, sometimes it's helpful to get closer to your nipple and areola and do a little bit of compression there to help push that out of your nipple. Now I recommend hand expressing 1 to 2 times a day for 5 to 10 minutes at a time, and you can alternate. You can start on one breast, go to the other side, go back to this breast, just for a total of 5 to 10 minutes. Finally, you're going to collect it. You can use your syringe to draw up your colostrum directly off of your nipple, or you can use something like a spoon or a medicine cup, as long as it's sterile, to express onto and then draw it up using your syringe. After you're done collecting your colostrum, label your syringe, stick it in the freezer, and it'll be ready to go when you give birth to your newborn baby. Quick side note here, guidelines for storing your colostrum are the same as it is for your mature milk. So it's safe for 4 hours out on the counter, 4 days in the fridge, and 6 months in the freezer. So if you don't use it immediately after baby's born, you can use it in the future. Please be patient with yourself as you're learning how to express your colostrum. Even if you barely get anything or nothing at all, remember the amount you collect before giving birth does not reflect how much milk you're going to be able to produce after your baby arrives. Any amount of colostrum you're able to collect ahead of time is amazing, but it is not essential. As always, please leave any questions or comments below so I can get feedback from you or direct you to other resources that I think could be helpful. If you have a friend who is currently pregnant and you think they may be interested in harvesting their colostrum, please send them this video. Thank you so much for being with me today, and I look forward to seeing you next time.